Walk Away Cancer is a creation of the Medicaid Cancer Foundation, which I started, and realizing that there's a great deficiency in the level of awareness of people about what the disease cancer is about, and generally to educate people. So we realized that we need to have an avenue where we can bring together people from all walks of life, stakeholders that are involved in the cancer continuum, the entire cycle, to teach, to impart knowledge, and most importantly, to show cancer patients that people are aware and willing to support them. The main inspiration, I'd say, therefore, came out of the need to create awareness and to educate the general population about cancer. To have any successful events, you have to have a very well coordinated, organized, and most of all, passionate team. And I think the Medicaid Cancer Foundation has been blessed by having this. Like we said, it has grown over the years since its inception. It's 14 years now. And so we have grown in terms of the numbers of people that are involved, the logistics that is required to hold the event, and also brought on board a lot more volunteers, people that are passionate about the cause, but don't necessarily have the time through the year to be involved. We start 6 months before the actual date and a plan, a theme, all that we want to inculcate into that year's work is thought about and planned very meticulously. A budget is an important part of it. And so all these things are done by a very capable team that know and have been on board. Of course, every year we have new people, but generally it's about coordination and having the right amount of passion. Walk Away Cancer is basically an awareness event. There are many aspects to the walk, but we do have a fundraising aspect through the sales of walk paraphernalia, the t-shirts, caps, wristbands, and so on. We're able to raise some funds to support cancer patients. So every year, actually ahead of the walk, we go to an institution where cancer patients are being cared for and offer them financial support. This has been our norm for all the years that we've been doing it. So that aspect is one. The fundraising aspect is a very important one. And I would like to encourage people to see it as such. Unfortunately, we do not have structured ways of giving in most low middle income countries. Despite our inherent altruistic nature, a community has one person that is sick, and you find out that the whole community comes together to support that person. It could be in the form of a chicken, some medication, even traditional medication, but everybody will visit, they will show care, and they will encourage the sick patients. But for us to structure it into a laudable and actual working health insurance system is what we have not been able to do at the community level. So, but I encourage people and organizations that are interested, that want to do some corporate social responsibility, to partner with Medicaid Cancer Foundation, which is a reliable organization and has been in existence for so long and has been impacting upon the lives of patients with cancer. It's very open, and so we will be able to make sure that the relationship is mutually beneficial. And so all these various stakeholders and aspects that come together to have a magnificent and huge Walk Away Cancer every year, I want to offer my heartfelt thanks, my heartfelt gratitude, and to assure you that Medicaid Cancer Foundation is not a flash in the pan foundation. We're going to be here even after me. We have continuity plans, and we know that this is a disease that if we work together, we can combat and we can really end the scourge of cancer in Nigeria. So I thank you, and I urge you to continue to work with the Medicaid Cancer Foundation so together we can beat cancer.